This is a C. Jason podcast, and I'm Jordan Nestor from Columbia University. I will present our work on the return of genetic results in nephrology. Genome sequencing is emerging as a powerful tool for diagnosing genetic forms of kidney disease, and recent guidelines recommend the return of actionable genetic findings to research participants. We developed a workflow to return results to 104 patients with kidney disease who were previously enrolled in our biobank, who had been identified to have medically actionable genetic findings on exome sequencing. But first we had to develop an infrastructure for the clinical interpretation of the genetic data, the recontact and clear confirmation of the research level findings, and then for the return and implementation of the results. We successfully returned results to 41 individuals whose findings encompass 21 distinct monogenic nephropathies, like Alport syndrome, Dent disease, Gittleman's, and renal cystic diabetes syndrome. We also returned results for 2 disorders caused by genes recommended for return as medically actionable secondary findings by the American College of Medical Genetics and Genomics, like the BRCA genes. During the course of our study, we identified over 20 challenges associated with our return of results program, including difficulty recontacting biobank participants, streamlining confirmatory retesting efforts, and then physician knowledge gaps in genomics. Each case presented us with a unique challenge that helped refine our program, and by collaborating closely with nephrologists, we developed a workflow that incorporated educational and clinical resources for both patients and providers. Embedded in the workflow were monthly genomic conferences on core topics for faculty, easy-to-follow genetic consultation notes that highlighted management best practices, patient communication tools, and then a curated expert referral list for patients who required additional surveillance. For all 41 cases, the genetic diagnosis had significant clinical implications. For example, the findings informed care, such as the initiation of a thiazide for hypercalciuria patients with Dent disease. It also guided cascade screening and assisted with living organ donor selection among at-risk family members. Further studies needed into the long-term impact of the genetic findings on nephrology care, including treatment and survival outcomes, transplant eligibility, and third-party payer coverage. I will close by thanking the participants and co-authors of this study and the Clinical Journal of the American Society of Nephrology for the opportunity to share our work.
This podcast is copyrighted by the American Society of Nephrology, all rights reserved. All content in this podcast is for informational purposes only and is not intended to be medical advice. This podcast should not be used in a medical emergency or for the diagnosis or treatment of any medical condition. Please consult your doctor or other qualified healthcare provider if you have any questions about any medical condition or before taking any drug, changing your diet, or commencing or discontinuing any course of treatment. Thank you for listening to this podcast from the American Society of Nephrology.